All right, I'm Joan Van Biesler, and I'm the director of Unitarian Universalist Justice Ohio. And I want to welcome you tonight to Healthcare and the Ballot. Our webinar features a number of wonderful panelists, and I'll introduce them in a minute. And just to remind everybody that we are being recorded and we are going Facebook Live, so you know. But as we start tonight, I would like to start with just a small centering by W.E.B. Du Bois. And he writes, "Now is the accepted time, not tomorrow, not some more convenient season, but it is today that is when our best work can be done, and not some future day or future year. It is today that we fit ourselves for the greater usefulness of tomorrow. For today is the seed time. Now are the hours of work. And tomorrow comes the harvest and the playtime." So thank you again for being here. Okay, let me introduce our panelists and then I'll tell you how the flow is going to go and we'll move out from there. One of our panelists is Maria Bruno, and she is the Civic Engagement Coordinator and Policy Analyst for COHIO. That's the Coalition on Homelessness in Ohio. And she facilitates the Ohio Votes Initiative, which is a statewide nonpartisan voter engagement campaign that specifically targets underserved and low propensity voters in the state. Maria has been working on voting rights issues since she graduated from OSU Law School in 2015. And she believes everyone's voice is important and everyone deserves access to the electoral process. And she does. She works very hard to connect voters with tools and resources and training to become their own best advocate. Maria, please wave so people know who you are. All right. And next is Graham Bowman, and he is staff attorney with the Ohio Poverty Law Center. And he works with legal aid attorneys who provide free legal services in each of Ohio's 88 counties, advocate for policy solutions to problems their clients face regarding health and public benefits and housing and domestic issues. Before returning home to Ohio, he was a legal aid attorney for homeless youth in Chicago. And Graham has been working to address poverty through public policy advocacy for over 7 years. And Graham, if you want to wave hi, thank you so much. And Bob Krasen. He was a Catholic priest in the Cleveland Diocese for 17 years and served in 4 parishes. And he moved to Columbus in 1985. He worked in human service organizations until he retired in 2005. Now, since retiring, he's volunteered for SPAN, that's the Single Payer Action Network in Ohio, which seeks Medicare for all on the state or national level, and he's now the Columbus area coordinator for the organization. So Bob, please say hello to folk. Thank you. And then we have Steve Wagner, who is the executive director for UHCAN of Ohio. That is the
Universal Healthcare Action
Universal Healthcare Action Network. I was looking for whether it was advocacy or action. Thank you, Steve. Joining in January of 2016. He believes that regular people must have a significant role in the way healthcare is provided. And Steve is a member of the Ohio Bar and graduated from Capital University Law School, University of Michigan School of Public Health, and Case Western Reserve University. And those are the folk that are going to be talking with us tonight. And I thank every single one of them. Let me tell you what we're going to be doing tonight. We're going to be discussing how various parts of our governmental structure, of our system, and our elections are related to major health care concerns and policy creation. We're going to start with some of the local issues like city, and then county, and then go up to state and federal issues. And at any point, please feel free to go into the chat and ask questions there if you want to. We'll also be taking questions at the end. But you can use the chat room if you've got an issue or question that's immediate, and I'll be looking at the chat rooms as we move along through this. So let's get started by looking at what happens at the very local level, the city level. Where does healthcare come up? In the regular governing part of, the metropolitan concerns. And where are there decisions made at that very local level? Panelists?
So I can start just by talking about what at the local level is coming up for election, and then I'll hand it off to our healthcare experts here. It'll obviously vary by where you are in Ohio as to what's going to be showing up on your ballot. A great way to find that out is a website called vote411.org. That's a nonpartisan website that allows you to pull up a sample ballot, and it's provided by the League of Women Voters. Just as sort of an exercise, I did that for a couple different spots in Ohio, and of course the races varied a lot, but just as an example, in Cuyahoga County, they have everything from the prosecuting attorney, the county council, the Court of Common Pleas, and city council all showing up on the ballot. So each of those folks plays a different role and affects your healthcare coverage in different ways. So I will let the others take it away, but that is what can be showing up on your ballot.
So I'll add the other things that will be on your ballot that will could potentially be in your jurisdiction would be levies, whether that's for developmental disabilities, for your public health agency, for your alcohol, drug, and mental health board. All of those levies are critical for helping to provide either health care or public health within the community in which you serve. And those will usually through a levy mechanism is how those will appear.
Yeah, this is Graham. I'll jump in there to kind of build up what Steve said. County human services levies are a huge deal. And one trend that's happened in Ohio over the past 10 years or so is as tax revenues have gone down at the state level, communities have had to step in and either raise various sorts of taxes at the local level or implement these levies to fund a lot of the human services. So I think I saw some numbers from the Center for Community Solutions recently that said it's like over half of Ohio counties have human services levies that are on the ballot. And these dollars can really be some of the quickest dollars to get out the door in times of crisis. So I think we're seeing that right now with the coronavirus. By definition, if it's county money, the county is going to get to say how they use those dollars. So right now, when you see human service agencies in your local community very quickly responding, oftentimes it's because they have a human service levy that's available. And it's those local elected officials are the ones that are, oftentimes promoting those levies and proposing them and pushing for them locally.
Do you see that the current COVID-19 emergency is going to be impacting or shaping what shows up on the ballot at the local level there, especially in terms of those human those human services levies?
So I don't know necessarily if there's a healthcare related tie-in, but I do know that the current policy is not to allow virtual signatures for different ballot issues. So if there is to be a ballot issue that someone wanted on the ballot this year, they would have a very difficult time gathering signatures by the deadline, considering we are not all leaving our houses. So that in that respect, that is a big impact that is a result of COVID-19 specifically.
Okay.
I would say a similar thing about Columbus Community Bill of Rights was seeking signatures for a ballot initiative this year, and we have had it cut short by the COVID-19 crisis. And we're still trying to persuade the city government to enable us to go forward once it stops and give us an extension so that it can appear on the ballot. This has to do with clean air and clean water, especially clean water in the city of Columbus. We have fracking injection wells north of the city, and we're concerned that the effluent from those can impact our drinking water. So it's a big issue, and we've been shut out so far by that.
Mm. Okay.
I think that's an interesting question if we'll see more ballot initiatives. I mean, other than just the sheer logistical hurdles that Maria brought up. I don't know, but I think that one kind of overall point that I think it's important to make about local government is oftentimes they have to step in when the levels of government above them don't address a particular issue. And I think that's what you've been seeing for many years. In the education space, you see county levy dollars used for kind of additional programming for students with special needs, and education funding has been a chronic issue in the state for many, many years. Yeah, so it's interesting, to wonder what we'll see. But I think a bigger point too is that really your local elected officials, like your mayors, your county commissioners, they're the only elected officials that every day are waking up thinking about that particular community, as opposed to multiple communities in their jurisdictions. So during this coronavirus crisis, for example, Governor Mike DeWine, he says, every time he speaks, how he's a big proponent of local government. And I know that every morning he has a call with a group of mayors about what they're seeing on the ground. And those are the leaders in your community that are saying, this is what Dayton needs, this is what's not happening. So they are really the champions for your community. And if you have strong leadership at that level, it's likely that community's issues are going to be effectively communicated up the ladder. And the opposite is true when you have someone that maybe you feel doesn't respect your values or your expectations.
Okay.
I would just say one other issue about local levies is that in a time of crisis, I think everybody closes their wallets and sits tight on what they have, and they will be very concerned going forward to vote for a levy when they are worried about their income or being able to go forward themselves. So I think a lot of levies that are really needed for public service will be threatened by this virus, and people are maybe much more likely to vote against them, even though it is in their very best interest to vote for them in this time.
Mm-hmm.
Any other Go ahead.
Well, just one last thing, and I think Steve is maybe more the expert in this area than I am, but one thing that was striking to me when I moved back home to Columbus was I had never really appreciated and understood this concept of home rule in Ohio. So we are a state that really believes in local control of government. So a lot of the major decisions around public health, how public benefits offices are administered, things like that are delegated to the local communities. So, we're seeing wonderful leadership in this state around this coronavirus crisis, but a lot of the actual work and decision-making is being done by, and I think Steve probably knows the number, but it's something over 130 different local public health districts in the state that are responsible for making decisions about, what do we do about homeless shelters? What do we do about congregate living settings? There are local officials that are making those decisions. There are local county commissioners that are kind of navigating all of those kinds of decisions. So in Ohio, I think more so than other places in this country, there's probably, I would say, a lot more power at the local level of decision making being made.
And then to get at, it was one of the base questions that we as presenters talked about, what isn't controlled by an election? And so many of these officials, whether it's a public health commissioner or the head of the Atom Board or others, are not elected officials. they're hired by a board, and that board is what's appointed by elected officials. So people don't have direct control over those individuals that are making some pretty critical decisions and also responsible for making things happen, whether that's public health or your elections or your JFS office.
And also similarly, I know that the next subject is going to be on state government, so I don't want to skip ahead, but I do think while we're talking about local government, it's worth mentioning that oftentimes the state government decides how much control the local government will have on an issue. So they might delegate a task entirely to the local government. They might, implement strict orders that they must adhere to. So it also depends on the view of the actual state government as to how much power is given to the local government as well.
We've run into that in Columbus Community Bill of Rights, where the state has preempted any local communities having anything to say about gas and oil drilling as well as waste disposal. And that is a current battle going on between the local communities and the state, is how much can people wrest back from the state their local control for safety.
Mm-hmm. Safety and health issues there.
So just a quick story in that vein that was really interesting. Toledo had a big fight with the state over their ability to control lead poisoning policy. So advocates in Toledo had pushed for an ordinance that would give them essentially greater control over testing and protections for tenants when it came to lead poisoning. That upset certain officials at the state level, who then tried to take away their ability to do that. So I think that all the levels of government are important, but oftentimes it's going to be your local leaders that can be the easiest ones for you to access, because again, their entire job is your issues as opposed to much larger swaths of people.
Okay. Well, we've mentioned county quite a few times. Do we want to move on to the county and talk about what aspects of healthcare, health policy we find at the county level, county commissioners of health, and where the decisions are being made at the county level?
On a public health side, public health departments can be city, county, or combined city-county. So you can have either kind of formulation. In Ohio, we do. So in Columbus area, you have Franklin County Board of Health, and you have Columbus Public Health, the major two health departments. Used to actually be more health departments, more city health departments in Franklin County. And again, they're in some ways that's those kind of city level or anomaly, right? We have county ADAM boards, we have county jobs and family services. A lot of activity happens at a county level, particularly I would suggest when it is about moving state money down through a local level. So state services, whether that's all the things that are provided through a JFS, or coordination of mental health resources, as happens with ADAM boards, or developmental disability boards, or otherwise.
What's JFS?
Sorry, Jobs and Family Services. So they're the ones working unemployment. They can help with Medicaid enrollment, other access to other social safety net kind of services.
Mm-hmm. There's a lot of money that comes through the county to Medicaid as well, isn't it, Steve?
Yes, sir.
So yeah, I want to echo what Steve said about job and family services. I think when we're talking about healthcare, and eventually I think we'll talk more about Medicaid when we get to the state and federal level, but Medicaid being the primary source of payment for kind of low-income families in America, it's a huge program and it's really important. So the local job and family services that is run at the county level is the kind of initial gatekeeper for people getting access to public benefits. When I used to work with youth in Chicago, this was really a lot of my work was spent with these equivalent agencies in Illinois. And the debate over healthcare, we talk a lot about how we deliver healthcare, what's the best way to pay for it, kind of all these big issues. But sometimes what gets overlooked is just the kind of boring application process itself, which in itself can be a massive barrier. The eligibility criteria for these programs are very complex. They're difficult to navigate. There's a whole bunch of politics that goes into play that creates incentives for counties or job and family services agencies to make it harder for people to get those benefits. So it's a lot of work. And what I found in Ohio, we work really closely with the job and family services, is that the quality of those agencies, which is really driven by the leadership and the county commissioners in the area, really affects those programs. And so in some counties, especially rural counties that don't have a big social safety net or faith-based kind of philanthropy community, that job and family services is really the only agency in that entire region that is there to respond when people are in crisis. And so if you have a poorly funded JFS or poorly managed one, or one that has a group of county commissioners that are kind of like breathing over their neck, making sure that they don't give benefits to people that don't want to have benefits. There can be all of these political and logistical issues that arise that can become huge barriers to people getting the services they need. And so the county commissioners can really have a strong impact on that. And that's why those elections can be very critical. And again, I keep coming back to the coronavirus just because it's on everybody's mind right now. But this is another thing that I'm predicting we see is we're going to see job and family service agencies that find creative ways to step in and help people that are in crisis, and other ones that take a much less proactive approach. And so we'll see the effects of that over time. So yeah, your county commissioners are very important.
Mm-hmm.
So shall we move on to the state level?
Well, I have one quick question here. Other than voting on county commissioners and looking for that on the ballot, are there other things on the ballot that would influence those jobs and family services that we're talking about? What do they watch for on the ballot when you're going to vote for something? County commissioners is about it?
Well, I think they all play a role. I think, obviously, as Graham mentioned, some of these positions are appointed, but they're still going to be appointed by someone. So
Right.
having an understanding of what elected official is going to decide who's in that spot is really critical. I mean, there's no better example of Amy Acton, who was appointed by Mike DeWine. She was not elected, she was appointed. And we are very lucky to have her, but that just as easily could have been some political operative had he decided to do it that. And look how much different our COVID response would have been if that were to be the case. So I think the county level, really all of these executive offices generally have a lot of power to appoint various offices. So there are things to look for on your ballot for sure.
Well, that's a good segue then into the state issues.
Yeah.
Want to start talking?
As far as issues, yeah, but we are also looking at Candace Keller, a candidate for state representative, and we don't want her there anymore. I think she may be changing to the Senate, but it would be nice to see her not going to the State House again.
Thank you, Liz. I appreciate that.
We did get one question from Facebook, Joan.
Okay.
Someone asked how do we think the county commissioners, how do we think we can get them more on board to support the jobs and family services in rural communities after COVID?
Okay. Anybody want to take that question?
I guess my initial response is get to know them and see how accessible they are and just try to develop relationships. I mean, like I said earlier, their sole job is to be responsive to the constituents in their community. I mean, in Franklin County, and frankly, I haven't thought. I'm not even sure the names of all of my county commissioners. I mean, there's some of them I do, but a lot of them I don't. So I think a lot of these elected officials, they're elected, but they don't necessarily have really high visibility. So I would just, as an initial matter, try to build relationships with them and see, you know, who they are and what their perspective is.
Okay.
And because these are folks that aren't often lobbied at, I think they are more receptive to folks lobbying because they, you know, they're not hearing one of 20,000 voices. They heard from 3 people this week and you're one of them. So that can be really impactful.
Okay.
I would agree with that. I don't think people see them very often and don't engage with them very often, and yet they have a lot of influence. So I wouldn't be afraid to call the county commissioners.
And this is some really good advice I got when I was first starting out as an advocate, is don't wait until you're upset about something to reach out to a local elected official. I think it can be a thankless job, and oftentimes the only people they're hearing from are people that are upset or people that have strong opinions. And I think it's human nature that if that's the voices you're hearing, that's the ones you're responding to. I think when there's things that your community is doing good that you appreciate, to communicate those. Don't wait until there's something specific that you want. And I think that's a way to kind of pave the way to having influence kind of on those decision making. I mean, especially at the local level, is that there's I think way more opportunity for just kind of one-on-one getting to know you opportunities, like Maria was saying.
Good point. I'm going to remind folk that you can type questions into the chat box right now, and then we'll also have open questions at the end. And we're going to move on to the state, because that's where we see a lot of health policy now, of course, but we also see that there's, you know, issues around Medicaid and women's health centers and many more things going on there. So let's talk about the state level. Where are the major centers of power around healthcare there? And what should we be looking for on the ballot?
Yeah. So I'll talk a little bit very briefly about what's on the ballot at the state level. There is no governor race this year, so we're with DeWine for at least a few more years, but every state every state representative will be on the ballot. So you will 100% guaranteed have a state representative on your ballot. The state Senate is on a staggered schedule, so you may have a state Senate race. And then there are 2 Supreme Court justice spots that are the Ohio Supreme Court that are extremely critical because their main job is to interpret Ohio law. So if a lawsuit comes in front of them about healthcare, the Supreme Court will be the court that is deciding who's right. So we've got 2 spots up for election on that as well.
Span, Ohio has a bill in the Ohio House. It is House Bill 292, which would seek health care for everyone in the state. It has been in the legislature since 2006. It finally had a hearing last session that extended for 2 days. It was a very, very good hearing. There were many proponents who spoke on behalf of getting health care from the state. It's a difficult thing to do in the sense that you have some issues about residency, people working across the borders and so on. But we think that those could be solved. They're not insoluble plot problems. And we have tried to convince the state that they could be first again in the country to do a Medicare for all type plan for everyone in the state, where everybody would be included, nobody would be excluded, and it would save us money as we're going forward. We had an economic study done, and it would save us about $25 billion a year in costs. The state would need to raise about $40 billion a year to pay for it, but we would save a lot of money in the long run.
Bob, what was that House bill number again for universal health care?
House
Somebody asked.
Bill 292.
Okay. And I see that Erin Rosiello has her hand raised about this issue. Erin?
So I wanted to find out, I am running for State House District 62, which is currently Scott Lips, and I understand he is on the health committee, or he runs the health committee.
Yes, he does.
And I was kind of wondering how that meeting went. I know my friend Kendall was booted from the meeting, and I was just curious, had we gained any ground?
I believe we're at an uneasy truce. No meeting has been scheduled. We have not had a meeting with him again, and he has not scheduled a hearing. We are going to continue to try to talk to him and members of that committee to see if we can still get a hearing this year. COVID has certainly thrown a wrench into that, because we're not sure when they're going to gather in the State House again and do any real business there. But we're still going to try to do that. It has been a very difficult struggle. While there are, I would say 12, 14 co-sponsors of the bill in the House, there are no Republican co-sponsors. And that's been a tough nut to crack, how to talk to Republicans about that this is a conservative issue. This is saving money, and everybody should be interested in that. And it would seem to me that it's in everybody's interest that everybody's healthy, because we don't want to get sick from each other.
It's a nonpartisan.
Absolutely.
Yeah.
Right.
Okay,
and just to
thank
bring
you.
it back to the ballot related to that, that House bill, just to give everyone a very quick Civics 101 primer, will go through a committee, which they just mentioned, Representative Lips leads, and then it will go to the general House floor, and then to the Senate, and then to the governor. So each of these levels would have approval or disapproval ability, which just emphasizes the importance of paying attention to every race, because each race will impact something as simple as one bill.
Exactly.
Mm-hmm.
Exactly. It's a very complex process, and you have to have supporters all the way along the way to make it happen.
And the other part of the civics lesson to remember is, once we have the elections, there'll be a small lame duck, but any bill that hasn't been moved and passed into law goes away, and everything has to start all over again. So who you're going to elect in the fall is going to determine all the bills that move forward come next year.
So one point to
And
make.
what Steve is referring to is that these bills have essentially an expiration date. If they stay put too long, then they get removed and we have to start from scratch.
Right.
So just to give some background on that.
Mm-hmm.
And so,
Graham?
Oh, I'm sorry.
Oh, Erin, did you have another question? Yes.
Yeah, I was just wondering, so let's say they get all distracted and we're concerned about November's election and they don't get to it during their lame duck on into the end of the year. Can you not just brush off that version of the bill and bring it back with the next group?
Yes, and that's what we've been doing for, I think, 8 sessions now, is bringing it back year after year.
Wow. Okay, thank you.
Thank you for asking.
They're persistent.
Yes.
But you have to go all the way back to go. You have to, as you know, you have to reintroduce, get through committees, get through House. So for any bill that's had hearings and move forward, it's a big setback to start again.
You always have to find the sponsors and help the sponsor find co-sponsors for these bills, because that's really important. These bills live or die by the number of co-sponsors that they're able to attract.
Mm-hmm.
you can never lose in politics, because the game's never over. So
The game is never over. Exactly.
So let me touch on a few issues that the Ohio legislature has historically engaged itself on, and I guess I'll say ever since Governor Kasich moved forward with the expansion without the legislature has been very in opposition to Medicaid and the expansion of Medicaid to people with higher incomes. And so they have repeatedly in the budget bills usually tried to limit how people could get Medicaid coverage, whether that was having to pay premiums or right now what we have in Ohio law, which is the requirement that they document that they're working. And it's been the Ohio House that has been a big leader in trying to put those barriers in the way of people being able to access Medicaid.
Yeah.
And I have a question for the rest of our panelists, which is, what are examples of ways that state government can impact health policy that federal level folks won't necessarily be able to impact?
Yeah, so I'll step in. First of all, when we're talking about the General Assembly and these things like single payer and these pieces of legislation are really challenging, one reason it's such an uphill battle for some of these issues in Ohio is because the General Assembly, the Republicans have a supermajority, which means there are so many members of one party in both houses that even if the governor wants to veto a piece of legislation so he can stop it from becoming law after it's been passed by the General Assembly has enough votes that they can override that and make it become law. So the General Assembly in Ohio has an enormous amount of power right now. So the question being...
Hey, Wesley, what? I need my Beano.
So the question being, what can elected officials in Ohio control as opposed to the federal government? When we're talking about healthcare, what that means for most low-income communities in Ohio is the Medicaid program. That ensures essentially every single person who's a citizen, and a lot of immigrant communities as well that are have some sort of status, that are making about under 138% of the poverty level. So that's like anybody who makes approximately $16,000 or less is covered by Medicaid. However, Medicaid is a jointly administered program at the state and federal level. So what happens is the federal government puts up the money from anywhere between 50% to close to 100% based on who we're talking about. And then they set the guidelines and the rules. But then from there, the states have an enormous amount of flexibility to determine what additional rules to impose. They have the ability to ask permission from the federal government to change the rules. So a lot of the nuts and bolts about how your Medicaid program operates that really affect people on the ground are determined by the state level. So Steve hit on this, in that there's been a battle in Ohio between the last couple governors of both parties in the General Assembly over the Medicaid program. So Governor Kasich decided that he wanted to expand Medicaid, which was an option that was made available in the Affordable Care Act, to anybody who is low income and an adult who wasn't already covered. So this is your typical working adult that isn't disabled, that doesn't have kids. Governor Kasich decided to administratively just cover all of those individuals. Since that decision, there was a backlash for most of his administration, where members of the House sought to take away his ability to administer parts of the program. So they created what's called the Joint Medicaid Oversight Committee, which is a legislative body that controls the growth in spending in Medicaid. It can control what services are not covered, things like which populations can it be expanded to, and things like that. So they can set a lot of the rules. And one thing that the General Assembly has been pushing for years, Steve and I have been, I think, feel like every 2 weeks we are in some sort of conversation about pieces of legislation like this, about imposing work requirements or drug tests or cutting certain benefits, or just anything that curtails access to healthcare as a way to kind of limit the extent of the program. So those are debates that are happening every single day in the General Assembly that we're a part of, and that it doesn't matter what part of the state you're in, your state senator or representative is somehow involved in those debates. And just their mere existence can lead to some of these kind of horse trading decisions that get made that allow bills like Bob's single payer bill to get additional hearings and things like that. So kind of one thing that I always joke about is I just wish that if I could do anything, I would get people to focus more on their state elected officials than on the federal level. I mean, there are like big critical, what kind of country are we type of decisions made at the federal level, but a lot of the really serious decisions around healthcare are decided at the local level. I've been talking about, so I'll just give one good example. So one of the big issues in Ohio is are doctors available in your county, in your region that are nearby? So do I have to drive an hour to go to the pharmacy or to find a specialist, or do I have somebody in my community? The amount of doctors available is directly related to how much they get paid. So if Medicaid doesn't cover very much, you're gonna have a harder time making a living as a doctor in a small community. So what's been happening is as the General Assembly puts stricter and stricter requirements on the Medicaid program, reimbursing doctors less and less, those networks of providers start to dry up and it becomes harder and harder to find a physician. And so those are decisions that are intimately decided upon at the local level. And the big area this has been playing out in the last year or so, if not longer, is around pharmacies. So, I mean, we could have an entire webinar about how drug prices are determined in the state, how much pharmacists are reimbursed for the services they provide. But what's been happening is a slow drying up of pharmacies throughout the state. And this is it's becoming harder and harder and harder to get access to prescription drugs. And that is a decision that's primarily being driven by decisions at the General Assembly and the Department of Medicaid and not at the federal level.
I think the philosophical camps that determine this discussion about Medicare for all are two. One of them believes that healthcare is a human right and that everybody ought to have access to it. And the second group is, I worked for my health insurance, I worked for my health care, let them go and do the same. And unfortunately, I think there is a majority, at least in the legislature, that is of the other mind, that I worked for mine and let everybody else work for theirs. And no, we're not going to give you much help toward that. And that's really sad, and I wish I had a way of turning the key to change that.
Let me ask you guys a question, or go ahead, and then I'll ask a question.
This is Miles Johnson, Miles J. from Warren, Ohio. I have a question. You know, and I've been organizing for a while now, but I just want to ask folks on the call, what do we consider when we say focus local? Is that the local council person? Is that the local commissioner? You know, how far should we go, or how small should we make the circle, if that makes sense?
Thank you.
Yeah, I think it starts with your, as you're saying, with your city council people. I mean, I think trying to influence those individuals and then working to your state representative, your state senator, those are excellent people to be trying to influence, because they make a lot of decisions that impact on your local community. A lot of decisions about how much money goes into the community or doesn't go into the community. So I think that's, when we make the statement about thinking local, people tend to focus on that presidential election and maybe that's it, and forget that those local officials, city council, and your state reps are super important.
I would add one other thing. If you go to talk to somebody local, somebody you know well, and they say, well, I'm the wrong person to talk to, always ask them for a referral. Who should I go talk to? Who can help me with this problem? And get them to refer you up the line. And then when you go to see that person, you can say, well, Joe Jones back here in whatever town you're from, referred me to you. And he said that you would have an answer for me. And don't be afraid to lean on him. And if he can't give you an answer, then say, who should I go talk to? Always ask for another referral. Keep going up the line of referrals and don't let up on them. Good question.
So I
Yeah,
think that's really great, a really great point to make about, these social circles for these local politicians are pretty small. So even if you're not talking to the right person, I guarantee they know the right person. So you just have to ask sometimes.
And one thing that's interesting too is who has power in the General Assembly. So who's a senator or state rep that really has influence, can move legislation. A lot of times can just be sort of random based on their particular, political abilities, whatever you want to call it. So for example, the state senator that probably has the most power when it comes to Medicaid, Senator Dave Burke out of Marysville, but he represents, Steve, you can probably tell me what his district is, but I can't remember. But he is extremely influential over Medicaid just because he's a pharmacist and he knows about it, and has the ability to communicate well on this issue. And so, he might be your senator. So your community might have enormous amount of influence over the Medicaid program just because of the random chance that this person happens to be your representative. So kind of when in terms of where do I spend my resources, on who do I organize? Do I try to go to the local level? I think it's just looking at who these people are and what their influences are and see where you have an in. So for example, Mayor Nan Whaley, in the last year or so has become fairly influential. She has the ability to work across the aisles, and I hear a lot that a lot of people in Republican leadership listen to her. So if you live in Dayton, now is a great time to be speaking to your mayor and your local officials because they have the ability to, move things up the ladder. And I'm sure there's a number of other different relationships like that I'm not even thinking of, but just kind of figuring out who has influence and whether they're going to open up the door to you.
And of course, the other side of that coin is if there are very influential people, you want to make sure that you're not gratuitously ruffling their feathers, should I say, and you're making smart advocacy choices around those folks, because if it's as simple as them saying no way and you're done, well, that's an unfortunate path. So really make sure that you're paying attention to being nice to the right people, but also, and that's not to say don't push them, but definitely just be intentional about your communications with everyone, regardless of how you feel personally about them.
And I think that's really important. And one thing I'll say too is, I know we're talking about voting, but in terms of just broader advocacy, I am surprised by the lack of people that come into the General Assembly to testify about issues they care about. It's completely open to the public. They can't say no to you. It really just takes an email to get put on the schedule to speak. And I think especially the better elected officials really value constituents coming in and speaking about their issues. They hear from lobbyists like Steve and I all the time. They're sick of us. I think they really value people that have actual experiences in the issues that they're working on, that just come in to tell their stories. I've seen examples of legislation where the entire bill was changed because one person came in and told their story. So that stuff really, really matters. And it's difficult for people that are sort of professional advocates to be able to kind of do the work to find people to invite them to come in. It's hard to do. So if you as a constituent or as a community member are following these issues, reaching out to some of these advocate groups that are following these pieces of legislation every day, and finding ways to plug in, I think is enormously valuable and needed, and just something I don't think we have enough of in Ohio.
And five constituencies from a state representative district is the equivalent of hundreds of folks from a U.S. Senate district. So there is power in numbers, but proportionally it takes fewer people. So get your friends together and go.
I have a question for the panelists. We've been talking about the fact, what the political environment has been around healthcare now for some time. And I know that many analysts are saying that the new normal after the pandemic is not going to be like the old normal beforehand. How do you see COVID-19 changing the political environment around healthcare in Ohio?
I think that's a really interesting question. I've been thinking about it a lot. I definitely agree that there's going to be big changes. I don't think anyone can predict what they are and how they will play out. I think that what we are going to see over the next 2 years or so is a lot of severe inequalities and dysfunction in our healthcare and social safety net systems that have always been there, um, that are going to become very, very apparent to people that maybe don't think about these issues on a daily basis. You know, we have 30 million uninsured Americans in this country, and that is going to affect our ability to respond to this crisis. I could speak for hours about how hard it is to get Medicaid and how hard it is to get through these JFS offices to get benefits. Our healthcare system is not designed with public health in mind. So all of these inequalities and long-standing health disparities, and I know Steve is really passionate about this issue, or disproportionately affect communities of color. All of this stuff has existed before this crisis, and it's going to make them worse and make it more obvious in ways that are not as easy to deny, that your average person isn't maybe aware of. How that plays out politically, I don't know, but I think it's going to be really interesting. I think it's safe to say that people are going to, no one knew who Dr. Acton was a year ago. I don't think most people can name the previous director. I know I can't. And I know public health has historically, the Department of Health has historically been this sort of backwater state agency with not a lot of money. I think the previous director was like some sort of like highway expert or something. I can't even remember, but they were not a public health person. So now Director Acton is one of the most, famous state officials in the country. Now, curve and all of these sort of public health terms are out there. So that's one area that I am optimistic in, is that there's going to be this greater emphasis on public health and social determinants of health. So the ways in which lack of safe and affordable housing leads to health crises. But politically, I don't know. But I think there are going to be changes. I just don't know what they are.
Yeah, I think I'm a little bit more skeptical than Graham. I mean, I hope big changes will come from this, and I think this certainly blew holes in some common talking points. I think the main one being that your health insurance should be tied to your employer. I think a lot of folks are reconsidering that point of view. But there are a lot of folks who are going to need to be dragged kicking and screaming before they actually make any big changes. So I don't know what that'll amount to.
It sure has, exactly. It sure has pointed out the folly of healthcare tied to employment. People lose their jobs and they suddenly, oh man, I don't have my health insurance anymore. And that's a disaster. There have been, 9 million people in Ohio have lost their jobs, and a lot of them have lost their health insurance. So the numbers we had on how many people didn't have insurance, they're blown up really high now. And that's really a good case for Medicare for All, because even if you have health insurance and it's guaranteed for this year, the prices are likely to go up by 40% next year. Who's going to put up with that? Who's going to be able to afford it? So I think this COVID-19 is going to be a line in the sand that helps everybody realize that we need something that we can depend on, and it's real health insurance. It's not fake health insurance.
I think that unfortunately, I guess so my evidence comes from the governor's briefings, right? Director Corcoran was on once. They talked about a very wonky waiver, and at that time, the governor didn't even know what the waiver was for. There hasn't been attention on healthcare in the same way that there has been about unemployment or food and so I just don't see it happening. The way this is played out, it's not happening. I do think, though, we have a fantastic opportunity on the health equity side, because we do have both DeWine and Dr. Acton's attention on the significant disparities that are happening within Black and brown communities in terms of how this has impacted, and that it is something that's been there forever and just simply hasn't been addressed. So I'm hopeful we can continue to push that. And I mean, actually, the Ohio Commission on Minority Health just put out 6 policy papers, which were, I thought, very pushing the envelope in terms of what I've ever seen come out of Commission on Minority Health, talking about what needed to happen because of COVID, and it really gets at some of the structural racism and other problems that have led to the disparities that exist on a health basis. So I think there is opportunity there, but I really don't think there's opportunity in the same way to really reform the system. And then just one last point, you'd asked much earlier, we talked about what is it that the feds can do that the states can't, or states can do that the feds can't impact. And the one place is uninsured, because it's unregulated, right? You know, who's uninsured is, they just don't fall under anything, because state and feds have different authority over insurers. So Labor Department has authority over big employers' insurance plans. The marketplace is controlled by the state. Medicaid is a joint federal and state kind of thing. So there's this dance that has to occur on regulation between states and feds. But all the 9% of the people in Ohio that are uninsured, that's Ohio's problem. Ohio can fix that themselves. They don't need the feds to fix that. They could do something about it today.
One simple thing they could do, they could expand Medicaid to cover undocumented children. You know, that's if other states do that. Would it ever happen in Ohio? Absolutely not, but it's something that the state could do.
It is interesting that in all the Medicare bills, they don't talk about citizenship, and they don't talk about the necessity for having legalized status in the country. They cover everyone. They cover everyone.
Actually, the feds did do something, I will say that CMS did something good recently. I don't say that super often, at least in the past few years. But CMS did just say that they created a way for providers to bill for any COVID related expenses. And all they have to do is show that the person was uninsured. So they don't have to talk about their documentation status. I don't believe this is going to fall under the public charge rule, so it's not a problem in case you're trying to pursue citizenship. So it is something that, now on the other side, who's heard anything about that? The governor's not talking about that. If you've got COVID and you need treatment, go, because you're going to get covered. That's not out there.
Oh, and remind us what CMS is.
Yeah, thanks. So at the federal level, it's the Center for Medicaid and Medicare Services. They're part of the Health and Human Services Department under AZAR. But they're the ones that make decisions on Medicaid and Medicare policy.
So shall we move to federal?
Yes.
Yeah. Okay. So I don't know if you all have heard, there's a presidential election coming up this year. Obviously, that's the one that gets all the buzz and attention. Also, some senators will be up for re-election, but neither of Ohio's senators will be up for re-election. So that being said, the term for the United States House of Representatives is 2 years, which means every even year there's going to be every representative on the ballot once again. So you will have the opportunity to vote on your federal representative as well.
Indeed. So look out for those people, and don't be afraid to ask questions of the candidates where they stand on healthcare. You know, they need to be taking a position and need to be working on something to solve the healthcare issue. So don't be afraid to ask questions about where they stand on delivery of care.
Have you seen the representatives issue statements about health care as part of their preparation for the election yet?
Some of them. I've been trying to track those locally. The congressional 3rd district race is kind of interesting because while now help me with their names. Oh dear, who is the current congressional member of the 3rd district? She's on television all the time. Anyway, she is a co-sponsor of Medicare for All in the Congressional House. She has not touted that as she is advertised, where Morgan Harper, who is running against her, is a dead on.
Joyce Beatty.
Joyce Beatty, where Morgan has just been really very much on that issue. And it would seem to me that Beatty would have the leg to say, hey, I'm a co-sponsor of that bill. You know, you can't go after me on that. But she hasn't said that. So it's interesting how I think that Medicare for All is a very an election-based issue that you can win on. You can actually win on it because a majority of people now want to see Medicare for All. But very few candidates are ready to take that risk to campaign on it, which I find striking, but what do I know?
So this is where Congress is really important, because any kind of major fundamental changes to the healthcare system are going to be acts of Congress. And with that, kind of the federal appropriations of money to make that happen. So really the fight right now within the Democrats is we believe in universal health care. We got really close to it with the Affordable Care Act. How do we get all the way and cover everyone? And so you have members kind of further to the left, like Morgan Harper, who's running for the House of Representatives in Columbus. Other member like Bernie Sanders is really the champion of this, is Medicare for All, so all Americans covered by the Medicare program. And then there's been this back and forth debate over how quickly do you go to a system like that. There are a lot of people that react strongly in a negative way when you say you're going to completely change the American healthcare system and get rid of private insurance and replace it. And so Joe Biden, the presumptive nominee, his position is more of a, let's keep the ACA, people like their private health insurance, but let's give them a public option. Let's make it better. And so he's trying to get more at that sort of cautious voter who kind of doesn't like big change. But then you have a lot of other people saying, well, from a policy perspective, we have to have the big change. So I think that in terms of what would actually ever even get through today's Congress, I mean, it's unlikely that a really big bill would pass, but then we don't know because the Senate can flip. So there's a lot of uncertainty out there. But I would say that the differences between the Democrats, some of them are substantial, but they're massive compared to what the Republican Party has been pushing for the last couple of years. I mean, ever since the Affordable Care Act was passed, which was probably the biggest piece of domestic legislation I've ever seen in my lifetime, and maybe we'll see. I mean, the Affordable Care Act was a huge, huge deal. It was really, you know, you could call it 6 different major reforms all wrapped up in one package. Ever since then, there's been a concerted effort to repeal it. And one story I wanted to make sure I brought up is that, I mean, many of you on this webinar might have been involved with this or following it back in the summer of 17. After Trump was elected, there was a huge push to repeal the Affordable Care Act whole cloth. Every member of Congress was being aggressively lobbied by, you know, their entire communities, and really came down to a kind of 11th hour vote where Senator John McCain broke with his party and killed the piece of legislation, and that's why we still have that bill. So to me, that's kind of a classic example of why every vote in every office counts, because you never know when there's going to be a really, really close, tough vote. And your elected official could be the difference between getting a kind of Joe Biden, more moderate change to the Affordable Care Act versus getting, you know, wholesale Medicare for all. depending on your views, one of those is good or bad. But really, that kind of major change can only come from Congress.
I would
And
say,
just a reminder, the process for getting anything through is the same as the state level, which it goes to either the House then the Senate, or the Senate then the House, and then is ultimately approved or disapproved by the president.
And one thing I wanted to bring up about, if we're specifically talking about Medicaid, and Steve brought up CMS, is the president has enormous amount of power over the Medicaid program outside of what Congress authorizes or dictates. So this is something we've been seeing since that big fight in the summer of 17, is the current president's CMS agency has been issuing rule after rule after rule that is designed to achieve the effect of repealing the Affordable Care Act. I think they said explicitly that they're trying to blow it up. So they've been pushing work requirements. So Ohio currently has a work requirement for Medicaid that will go into effect next January, unless it gets thrown out by the courts, which is happening, thankfully, in other parts of the country. They've been doing a lot of just different little administrative things that are going to make it a lot harder to have a quality healthcare system. And the president's doing that using his administrative powers to interpret laws passed by Congress in the way they see fit. And so from my perspective, that's a bad thing now, but also you could see if we had a different president, but we still had a split Congress, that president could still do a lot of good within the Medicaid program. One thing that I've been hoping for years is a friendly administration that would allow Medicaid dollars to be used for things like rental subsidies or other sort of housing interventions. That's something arguably a president could do without Congress. So the election is enormously important, even if the outcome in the Senate is uncertain.
I am a student of history, and I would say the stars align to do big things about once every 50 years. And I think we're getting to that point. The points are often determined by crises. Franklin Roosevelt came in a crisis. Barack Obama came in a crisis. And we are in another crisis. And so crisis creates opportunity. So I'm 78 years old, but I'm hopeful that we have a chance to pop the cork on something big in terms of healthcare and catching up with the rest of the world who has coverage for all their people, and nobody goes bankrupt. Nobody has to face the issues and problems that we have gaining access. And it's all a bunch of nonsense that's been created by the system that now lobbies against us to do any kind of change. And that's what we've got to work against is the pharmaceutical, the health insurance, and the growing hospital conglomerates who have consolidated control and power of healthcare, and even marginalized the doctors and the medical providers. So it's really a very difficult scene that we see in America, and I think it's opportunity time to change it all. Ooh.
Is
Prophetic words.
I want to agree with you so badly.
Other comments?
Is there anything that we're learning during this crisis that points to a universal care as being opposed to emergency Band-Aids?
Yeah, I think we've said it kind of already. It's the fact your health insurance following your employment. It's really not a great model. So, that would be one of the best arguments for there being this kind of universal coverage rather than this patchwork of coverage based on who's going to pay for it.
So, and I'm not saying that this points towards people being more open to single payer healthcare, but I think it's going to be, one of the arguments that advocates for a single payer make is that it's less expensive. Single payers, if you have a single payer system, you have more leverage to negotiate better prices with providers. You know, this kind of patchwork system we have in America is enormously expensive. One thing that is going to happen is every state, or at least Ohio, I think almost every other state, is required to have a balanced budget every year. So between now and July, the Ohio General Assembly is going to have to cut massive amounts of spending. At a scale, this isn't just, you know, cutting staff here and there, like really systemic decisions are going to be made about the budget. Medicaid is by far the biggest budget item that the state has. And this goes to every state. It's just the amount of state taxpayer dollars that go to the Medicaid system are absolutely enormous. And it's politically very difficult to cut things like that. Medicaid, education, public safety, those are not budget cuts you can easily make. So I don't know how that's going to play out. I mean, I don't know how those decisions are going to be made, but you know, you can imagine not necessarily next year, but over the course of many, many years, that the current system just becomes too expensive, and people are, not for reasons of equity or charity or whatever you want to call it, come to the table for different reasons.
And Graham mentioned a really important point about negotiation power. You know, as he mentioned, Medicaid is such a big system, they would have more negotiation power for lower prices. A good example of, you know, how this manifests itself is, again, this COVID crisis. We have, you know, governors who are essentially competing for one product, as opposed to governors requesting a product together and being able to negotiate the price. So that is just sort of a parallel in the power that is the negotiating power of being one unit rather than several smaller units.
There's to Maria's point, yeah, I think COVID-19 brings this up in really kind of colorful ways. So New England Journal of Medicine wrote a very brief article about this. It was a kind of like an op-ed from a administrator at a very large Massachusetts hospital who said that they were desperate for these N95 masks that they need. They couldn't find them anywhere. They would try to order them and then the deals would fall through. There was just no way to get these masks and they were becoming desperate. So they found out about a Chinese company that was selling these masks, and they set up this deal where they showed up in kind of a abandoned warehouse, and then the masks were in like an unmarked truck, and then the FBI came and started questioning them about why are they buying these, and they were paying like 10 times what they were worth. So like all of these really crazy things are happening right now, where people are bidding each other up for these masks and other devices because there isn't a strong coordinated way to buy these things. And I think kind of my earlier point is these really kind of absurd stories are going to come out more and more and more as we get further in this crisis, and people are going to ask, why do we have this system like this? It doesn't make any sense.
Are there other?
I was going to say, I think there's one other hopeful point for me, and that is, I don't remember what it was that you said, Miles, but it made me think of this, and it's sometimes the way in which politicians think about whether people should get services is about deservedness, and that usually translates to this: you've worked hard and we think you deserve this. It's an entitlement. I'm entitled to health care because I worked hard. You're not entitled because clearly you're not working hard enough. And I think some of this crisis has changed people's view that people need to have these, that bad things happen to people no matter what. And some people have a lot more challenges than others in terms of even being able to make their way through a day to day. And so I think there might be a softening across the political, to some extent, some of the political spectrum about how people think about others, and that there may be a difference in compassion or viewpoint about this concept that some people deserve things and other people don't deserve things, and that maybe we should be having a safety net because we're all in this together, right? DeWine keeps using that. So that's where I get hope from, that maybe people, our attitude has changed.
I agree. I agree.
And I also think we've realized the implication of failing to insure so many people in our community. It means they have worse health care, which means there is more illness in the air. It means that we do have a more expensive system. So I think, you know, even if we don't get as empathetic of a population as we would like, there still is just the practicality point that is this, you know, expanding healthcare coverage is a better system for everyone, even someone who currently has insurance.
Yeah, Steve, you used the term softening, like you could almost call it like a confusing, where when you have 20% unemployment, it's really hard to keep track of which person you think isn't deserving and who isn't, you know, like, you know, okay, so of these 20% of unemployed people, which are the ones that I'm not supposed to like? You know, how do I keep track of that? It's harder to make these who's good and who's bad arguments when like everyone is unemployed.
It is a theological question. At the root of part of our society, we think in terms of the reprobates, the sinners, and those who are blessed of God. I mean, that's a neo-Calvinist approach to the good and the bad.
And who is providing all the human services that are going on now? Like who's bringing food to people's houses, and who's filling the shelves on stores, and who's doing all this work that is generally looked down on by people of more greater income. It's all these people are so critical to us right now, and we have to respect them as people and make sure that all of us are in this together in terms of care. That's a great point, Steve.
Are there any other questions? I know we're coming up to some time limits here, and a number of people have got other places that they need to be on. It's a time of many webinars in the evenings now. Are there any final comments or any final questions? Okay. Well, then I
just a final comment. I was just going to say, I think that if there was one theme to take away, it was the importance of thinking locally. Obviously, you know, we turn on the news and it's all about the president all the time. It's all about the Senate and the House all the time. It's always federal government, but so many critical decisions are made locally. And those are decisions that we can actually impact with less effort than we would think. So I think that if there's any takeaway, it should be the importance of all politics is local, as they say.
Yeah, and I will jump in really quick to echo that. If you're interested in getting more involved, I would encourage you to really, we talked earlier about building relationships with your local officials, but also, you know, there's a rich community of advocacy groups where we're doing this every single day. Maria's group, my group, Steve's group, there's other ones that have local presences, other ones that are more state. So I would encourage you just to figure out who those groups are and reach out and find ways that you can work together. It's been really fun kind of communicate with Joan recently when we've been talking about some stuff around evictions, and really that constituents that are living and breathing these issues in their communities, I think are always more effective voices than the lobbyists ever will be. My dream would be to never testify ever again, because I have real people that can tell their own stories and advocate for themselves. So the kind of people that are stuck in Columbus all the time to the State House, you know, aren't the voices they're only hearing from, because really it's real people that are more persuasive and more effective, and there's just not enough of it.
Christine has a question.
Yeah, I don't have a question. I just want to give a concrete example of the all politics is local. I'm from Westerville, and for most of the time I've lived here, it's been a very conservative community, but the Westerville Progressive Alliance has worked very hard over the past 5 years, 10 years, and we elected a majority progressive city council. And we're seeing that play out during this COVID crisis in the fact that City Council, we have a locally owned utility company, and City Council declared that there would be a utility company holiday in the month of April. Nobody will get a utility bill. And I ask that everybody who is financially able contribute to one of the local charities to help others who are not as able. So I think that's a real concrete example of the importance of local politics.
Thank you, Chris.
I sure enjoyed hearing the other panelists. It was good to meet you all and hear your comments, and it adds to my life. Thank you.
You too, Bob. Thank you.
And I want to just note that on the screen right now, I have put up a small slide about how you can be involved in voter advocacy. You can either sign up directly or email us or get a link through uujo.org, and you can work with the nonpartisan Ohio Voter Advocacy Committee that is headed by Maria that she talked about at the first, and become involved in helping people learn more about what's on the ballot, educate themselves about the issues, register and make sure that they are in there properly so they will not be turned away at the polls or the absentee ballots, depending on what we use. And you can help people and support those who need help in voting. So please, don't be shy, sign up to be a volunteer or email me and I will get you a direct link to things. So I think that that is the end of our time, unless there's any final comment that you want to say now rather than at 3 o'clock in the morning to me. Hearing none, let me just close in with a very brief statement from Howard Thurman, who said, "Do not be silent. There is no limit to the power that may be released through you." So thank you all for being here.
Thank you.
Thank you all.
Bye.
Thank you.